girl, that lady might say that you can't tell that you had a facelift.
Our healthcare system, our medical education system is very, very good in India.
So I enjoyed the Indian people. Naturally, I got along really well with them.
In US of A, in UK, Australia, in all of these systems, medical healthcare facilities, there are a lot of Indian doctors doing very, very well.
Well, I would say your hospital here is excellent.
The previous president also had a very artificial looking facelift. Hi, welcome to another episode of Plastic Surgery Podcast. And today we have a very special invite, Mr. Kevin. Hi, Mr. Kevin. Welcome.
Thank you so much, Dr. Gupta.
So, Mr. Kevin has had a facelift and neck lift surgery with us around 6 weeks back.
Yeah, a little 6.5 weeks.
6.5 weeks back. And he traveled all the way from Morocco.
Morocco.
Okay. So, that's the 51st country on the map from where patients have come to us for surgeries. So it was definitely nice having you with us. So today we'll have a small chat session about how your experience was about facelift. But before that, tell our audience who you are, what you do, and what were the issues you were facing.
Well, I'm Canadian by birth and I am retired. So I live in Morocco where it's nice and warm and I miss the Canadian winters.
Delhi winters were not that Canadian winters, of course, but Delhi winters were
yeah, Canadian winters are serious.
harsh. Yes. Yes.
Yeah. Other than that, I'm a musician.
Yes, I listen to your music, yeah.
Oh, thank you. And I'm also, my profession though, is I'm a gemologist.
Oh, wow, lovely.
Yeah.
Gemologist.
Yeah.
So what were the issues you were facing when you decided to come to us?
Well, because I play professionally, the look is very important. And as you'll remember, my turkey neck was down to about here. And it just made me look very old. And that's not really what I want when I'm in front of the public. So I researched quite a bit. And the thing that drew me to you was that pretty well everybody was saying that the results are natural looking.
Yeah.
And
We take a lot of pride in giving very natural looking result. In fact, I always tell them, keep them guessing.
Exactly. Like I had that girl, that lady, might say that you can't tell that you had a facelift. It's just like, yeah, that's you're known for that. I said, Dr. Gupta is known for that.
So you had a turkey neck and the jawlines was not defined. And
correct.
And then we decided to do a face and neck lift. So you said you did a lot of research.
Yes.
Morocco, one part of Africa, a totally different continent.
Yes.
Asia, Europe, Americas. How did you come here? How did you decide?
Well, I've been in, since 1984. I've come here several times. This is my 6th visit.
Oh, wow.
So I enjoyed the Indian people. Naturally, I got along really well with them. And then I came across, I thought, well, I'm going to India. Let me check out the doctors in India because you do have a reputation of being high quality.
Our healthcare system, our medical education system is very, very good in India. So, in fact, if you see in US of A, in UK, Australia, in all of these systems, medical healthcare facilities, there are a lot of Indian doctors doing very, very well. So you are right. Our medical education system and our doctors are pretty good.
Yeah. Well, I would say your hospital here is excellent.
Thank you.
My experience here was very good, recommendable to other persons like my friend. And I would come back again, which is exactly what I'm doing this time. We're going to do the blepharoplasty.
Yes.
And so I'm back for a second.
So it's good to have you back always. We have always had a nice conversation as well with you. So I want to know, one is, of course, your profession to look good.
Yes.
But when we talked about natural looking results, you see a lot of people roaming around after face neck lift. looking very, very artificial, tightened too much.
Exactly.
Even if I can say, although the existing US president is making a fun of himself, but the previous president also had a very artificial looking facelift.
Yeah.
If you've noticed that.
Yeah.
Yes.
Yeah.
So it's too tight so that the person cannot emote, express. So,
Yes.
So
yes.
how was when you saw your new shape of the face? Of course, initially you were swollen. You still are under the eyes.
Yeah.
You still are.
Yeah.
But what do you think your first reaction was?
Wow. Yeah. And I was like, oh my goodness, what a difference. Yeah. Very pleased, of course. And the healing process has just been natural. No hiccups in that. And it's gone very, very well. Very well. I couldn't have asked for better, Dr. Gupta. I really couldn't.
Thank you.
Yeah.
How daunting can it be mentally, maybe physically as well, to travel all along the way alone to India? India, we understand, with a lot of population, a lot of people around, can be sometimes overwhelming for people who come from slightly less populated cities or countries like you. But how difficult is it to navigate?
It was very easy.
Easy?
It was simple. It was logic. Your metro system here, which was not here when I was last time in 95.
Yeah, 95.
I mean, it's beautiful.
30 years you were back. In 30 years, every city
ago.
changes completely. The Delhi has
Completely
changed.
different. Completely different.
So the metro is very good, very network, nice.
Easy to use.
Yeah.
Yeah, I really like your metro.
And very cheap as well.
Very cheap. Very cheap. Oh, yeah. The metro in Paris is what you call expensive.
Oh, and that metro is not. I didn't like it. It's not pretty nice and tidy there.
Yeah, this is nicer.
Yeah.
It's wide open.
Yeah.
Yeah. So my experience with, shall I say, the Indian people has always been very, very pleasing. And I find the Indian people to be very kind.
Generally, our civilization is like that. We are kind. We are helpful. If anybody seeks for help.
Yes, that is true.
Yeah.
Yes, I've experienced that many, many times here.
Lovely.
So it's a wonderful experience too. As I say, India is so full of culture. It's like just step outside your hotel room door and the show starts. It's there in front of you nonstop. It's amazing.
Yeah, and India is a huge country. So if you have noticed traveling here, every 150 kilometers, the culture changes, the people changes, the language changes, the food changes. So India is a huge country, and a lot of people travel from across the globe, not just for surgeries, but also called as medical tourism. They roam around the country, they see sightseeings, they get their surgery done as well.
Yeah.
So another question to you, when you have lived in Canada and in Morocco, you must have gone to good hospitals. How was your experience in the hospital? Because sometimes people may think, oh, India might not be, people, I travel across the globe. Sometimes people have this impression of India just by a movie called Slumdog Millionaire. So I always tell that India has two sides.
Yeah.
So what was your experience with our hospital?
Excellent. I couldn't have asked for better. I was impressed, especially the day that I had all the tests to do, how it was like clockwork, just going from this to this to this, and it was just so smoothly done. I was very impressed. The professionalism is tops. Your staff is I think they're very competent, and they are very polite.
Yes, of course.
Yeah. So pleasing, very pleasing. And as far as the hospital overall, excellent. Absolutely excellent. You're not going to find better in Canada.
Yes, I'm sure. I've been to Canada. Yeah, see, there's a difference. Sometimes when we made this hospital, we made it like a very warm boutique, homely hospital. If these are the adjectives if I can use. So it's not like hospital cookie cutter style, white color, same desk, same chairs everywhere. We made it with some character of its own. So, and same goes with the people when we recruited them. Each of them are handpicked. They are well trained, and they do. We all do a work with a lot of love and passion for care, genuine care.
Yeah,
and that what reflects, isn't it?
Yeah, exactly. Well, that's what we all want as, patients with their doctor, is that humanity, which I do find in you. Yeah, I find you've got a really good heart.
Okay.
Yeah, you're welcome. But that's my experience with you. And when I was talking to Maite, that was one of the things I said. I said that he's a very down-to-earth human being. Yeah.
See, I heard this somewhere. You have to be down to earth. I'll tell you the story. Suppose someone gifts you a very expensive car.
Mm-hmm.
Will you show it to your friends? Oh, I have this lovely Mercedes or a BMW.
Mm-hmm.
No, you will think, oh, this is a gift, right?
Mm-hmm. Mm-hmm.
So you don't show off your gifts. You may show off what you earn.
Mm-hmm.
Isn't it? You understand the difference? Yeah.
Yes, sir.
Yeah. So consider this, that whatever we are doing right now, like getting good patients, doing good work, patients being happy, as a gift from God.
Mm-hmm. Mm-hmm.
It's not that what I have earned. It's a gift or a blessing from someone up there, spiritually.
Yeah.
And when you think like that, what's there to show off? You don't show off your gifts, isn't it?
Well, appreciating what you said. I have felt that I was led here by God because I did ask Him to guide me.
Mm-hmm.
Yeah.
Yeah. So if you think it's spiritually, just continue doing your work, which you love doing, you're passionate doing about it, and take care genuinely. Do whatever you can, do your best, and then be happy. Just don't,
learn along the way and show kindness and love to others.
Yeah. And that's what life is.
Yes,
isn't it?
Indeed.
Yeah.
Indeed.
So, any message I would like you to give to our audience who sometimes consider plastic surgery just for vanity, and how important is it for your own self? Do you feel that, or it's just to show that your face looks good?
Definitely. I feel better about myself. I feel like, I've kind of gone back. Well, I'm letting my hair grow now, and I'll continue.
Like a rock star musician.
Well, you know what? It's been a long time, but you know what? It's good. It's really good. For myself, yeah, definitely. It's my self-image is returned to what it was many years ago, and that can't help but be a plus, when I'm in front of people playing.
You can't be guilty about feeling happy. If you feel happy, you're good.
Right.
And plastic surgery helps you make you feel happy.
Yeah, I seen when I was looking at the comments before I came here, one of the ladies said that Dr. Gupta, he re-energizes your soul or something to that effect. There's comment in there, and I thought, wow, really?
So isn't it? It helps.
Absolutely.
I always say thank God for plastic surgery.
Absolutely. Yeah. And the beauty is that it's natural looking. Like there's still under the eyes a little bit here, a little bit there, but I don't mind that.
Yeah, that's important. I tell my patients, if you want all your lines away, I'm not the surgeon, because that does not look good to me. That does not appeal me. Yeah. There should be some lines, some naturalness, and that's what defines each individual face. If you pull up every face absolutely tight, everyone looks the same. Everyone looks like cartoon or chipmunk. It's not what art of cosmetic surgery is. Art of cosmetic surgery is to make you look better, and not maybe perfect. There is nothing perfect. It has to look better, a better version of your own self. Yeah. But your own self, Kevin should look like Kevin, and not like Peter. And that's what it's all about.
Exactly. And you are known for that.
Thank you.
You're most welcome.
Thank you. Thanks a lot for doing this podcast with us and coming in front of the camera and sharing your experience. I'm sure a lot of people who are intrigued about plastic surgery, about doing plastic surgeries, this will definitely help them.
My pleasure. Thank you so much, sir.
Thank you. Thank you, Kevin.